Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. So I'd like to start off each and every week. I'd like to say hello to all our loyal listeners. Of course, thank you for listening each and every week. And a special hello to anyone who is new to this radio show. This, again, is BackTalk with myself, Dr. Peter Pedduzi. We're on every Wednesday morning on KHB 620 AM from 9 to 10 in the morning. As I do quite frequently before I start the show, I'd like to give you a little preview of what we're going to be talking about today. If you are new, again, to the show, in the first half hour or so of the show, we typically talk about the wide variety of treatment options we offer here, all under one roof right here at the American Back Centers. Of course, American Back Centers was started over 40 years ago by Dr. Dennis Miskovich, and in the last 20 years, we started specializing. We've been known as the area's foremost disc specialty center. Because of the many years we've been doing this, since 1994, Dr. Miskovich saw the groundbreaking research, as I talk about each and every week, that was done by Doctors Ramos and Martin, two neurosurgeons, and this research was done on real-life subjects with pressure sensors showing, for the first time, and still to date, the only research showing that a non-invasive, non-surgical medical device could produce a reduction in pressure, upwards of a negative 200 millimeters of mercury. That's what you need, the negative pressure, to form a vacuum effect and reduce the pressure within the disc, and allowing for retraction of the disc material back off the nerve, relieving your sciatica, your disc problem, herniated, bulging disc, pushed back into place, relieving the inflammation, the swelling, naturally, by actually addressing the true cause of the problem, the compression on the spine, on the disc. Also allowing fluid and nutrients back into that compressed, that degenerated, that starved disc. If you actually look at the MRI, if you had an MRI done, you can actually see the disc desiccating, drying up, losing fluid much quicker than the normal aging process. When that occurs, you have loss of height, eventual arthritis, bone spurs forming. I tell patients it's kind of like a stalactite and a stalagmite in a cave. From the top and bottom, your body's trying to protect and correct the problem, the compression problem. And the problem, though, is it's trying to fuse the bone together, and then altogether your disc will dry up and desiccate from the starvation of what's occurring from the space closing up. Fluid, nutrients, oxygen are not getting into that disc anymore because of the compression. It's being starved. So it eventually dries up, and you will eventually get a bone-on-bone total fusion occurring. And then you end up having lots of problems and disability and pain with that. So we're able to help prevent that. And this is the first treatment that has done the research showing that conclusively it does what it says it does. And so to date, the only non-invasive, non-surgical device, contrary to what you may hear about these so-called traction decompression devices, the only device has actually used pressure sensors and shown conclusively that pressure is reduced to a negative level, forming that vacuum. And this was done way back in 1994 by two neurosurgeons and published in the journal Neurosurgery. So that's why Dr. Miskovich purchased not one but two tables back in 94. And for over 20 years now, we've been helping literally thousands of patients have come through our door, helping them. And with that, we get many referrals from our satisfied patients, clients, neighbors, relatives, people that hear about us helping the people that they know with these difficult disc-related issues, herniated disc, bulging disc, sciatica, stenosis, even failed back surgery cases. So again, this research was done back in 1994. Dr. Miskovich purchased the two machines, and now for over 20 years, we've been known as the area's disc specialty center because of our experience, and we have, quite frankly, the best treatment option out there, the only FDA-approved, safe, clinically proven, non-surgical disc treatment on the market. So in the second half hour of the show, we typically talk about a nutrition, or sometimes we pick out a fitness topic. Last couple of weeks we talked about a very interesting topic. It was more of a fitness topic, whole body vibration therapy. We do offer that therapy here at the American Back Centers, a part of our LipoLite program for stimulating the lymphatic system, allowing the liquefied fat from the lipolyte to be pushed out of the body. Also, older patients that have balance issues. There's even some research showing that regular use of whole body vibration therapy can help strengthen the bones. People with osteoporosis. So we talked about that last week. We also quickly talked about pneumonia a bit. There's some question if certain types of pneumonia is contagious, when it is contagious, what to do, factors that increase your pneumonia risk. We touched on that briefly last week as well. This week, our topic, very interesting, falling is taking a toll on the elderly brains. So not only is it taking a toll on your body, but also on the brain of the elderly patient or person who falls, per se. So we're touching on some fall prevention efforts, per se, lack of physical activity, increasing fall risk, easy strength training exercises to reduce your fall risk, taking care of your vision health to help prevent falls, and some other issues related to helping to make your home safer to avoid falls as well. A lot of people out there listening may be in that category that, you've had a hip replacement, knee replacement, or you're just getting older. You have osteoporosis, you have weak bones, and a fall could really, really cause damage to your body. So definitely stay tuned for that. If you know someone in that category, stay tuned for our fitness segment, nutrition/fitness segment today in the second half hour, and you may learn something about those type of issues. We do have these posted. We'll try, if we can, and most weeks we can. We do have time. If I get here early enough to prepare, I put the article on our Facebook page. So you can also go to McCullough.com. This article is from Dr. McCullough and McCullough.com, www.mercola.com. Print it off from there. You can go right to our Facebook page, American Back Centers Pittsburgh. Of course, like us. You can send us a friend request, our Facebook page, and you can also print out the article, which we'll be touching on today, or any of the past articles that we've touched on are on there as well. If you missed a show, you want to print off an article, you want to read an article right from the Facebook page, you can do that by going to American Back Centers Pittsburgh. Very, very easy. We just put it on there literally about 5 minutes ago, so right before we went on the show, so you can get that right off. Again, American Back Centers Pittsburgh, Facebook page. Remember, like our page. If you get a second, we'd appreciate that. And then also you can send us a friend request if you'd like as well. So definitely stay tuned for that in the second half hour of the show today. Okay, as we mentioned, of course, the American Back Centers, we are not your typical chiropractic office. Since 1994, the American Back Centers has specialized in the treatment of very difficult cases, including herniated disc, bulging disc, sciatica, stenosis, failed back surgery cases. We see some of the worst cases come through our door with multiple failed back surgeries, degenerative disc disease. And really what I'm seeing a lot of now, too, is, obviously we know spinal surgery. We talked about the risk, the lack of success, especially with spinal surgery, how it doesn't work. They're snipping off a piece of the disc, whether it's through the laser, and, of course, the laser is costing $20,000 to $30,000, $40,000 out-of-pocket expense. Scalpel procedure, not really addressing the compression. Patients have to go back and get another surgery very soon after. Even the fusion surgery, the rods and screws, very invasive. The areas above and below have to compensate, so 9 times out of 10 you got to go back in for another surgery. Now you have all this scar tissue complications that can result. It's not to say we can't help you, but it just creates more complications. But we're seeing a lot now, even with standard surgeries. I've had a couple patients with knee surgery, a neighbor with bursitis. I have a patient that just had a knee replacement. Both now with infections they have to deal with now. The one patient with a knee replacement had to have the knee taken out, treated with high-dose antibiotics. After the doctor finally figured out it was an infection. And coincidentally, we actually used the hemp oil for him because his prescription pain meds were not working at all to relieve his pain. He put the high-dose hemp oil, which we're going to touch on here later in the show, the highest dose hemp oil, CBD level 5, and it actually was the only thing that took his pain away, believe it or not. He was actually able to go out that day and work in the yard, believe it or not, with a knee infection of his prosthetic knee. So now he had a surgery, he had it taken out. They have to wait a while for everything to clear up with the infection, and then they're going to put another knee back in. And it's just a very annoying issue that people are seeing more and more of these days, infections and different issues with surgery. So again, our goal is to help you avoid surgery in the first place with our procedures, namely the BackTalk and the cervical decompression treatment options we offer here at the American Back Centers, as well as the rehab, chiropractic, nutrition, massage, all the things we offer all under one roof right here at the American Back Centers. The VaxD, of course, is a truly revolutionary treatment that has a proven track record of very time-tested treatment. It's been used for many years by medical doctors, orthopedic surgeons in private practice, chiropractic physicians, even physical therapists are using. All specialties are using and accepting VaxD as an acceptable research treatment option to back surgery. Even if you've had a failed back surgery, in many cases we can help you as well. Over 300 facilities, hospitals, medical, chiropractic, physical therapy clinics worldwide now use VaxD. This, of course, VaxD standing for vertebral axial decompression. So each week we ask, if you're out there listening, if you know someone, or you yourself, or you know someone who has severe back pain, neck pain, when we talk about the cervical issues here in a few moments, unresponsive to your current treatment, you want to avoid further pain medication, either self-medication, prescription, the steroid packs, which we know are going to give you good relief, but you don't want to be on a steroid pack forever because it's going to destroy your bones, just like any steroid. When we talk about steroid injections, epidurals, there's even more research out there showing now that they can be more harmful than good, and there's no evidence that they're going to help you long-term in any research study. It's short-term at best to give you some temporary relief. I tell patients in some cases, give them a try if you want to. In some cases, it may help resolve your disc problem on its own. If it's a very mild case, some disc conditions can resolve on their own with proper therapy, chiropractic, as well as injections if necessary if you have severe pain. But if you're not responding to that and it's not working for you, then why keep doing it? Because it's going to, in many cases, your condition is progressing. In some cases without notice because you're covering up or putting a Band-Aid on what's actually occurring. And you feel good, but the condition is progressing, and soon it's not going to help you, and then you're going to end up wishing you would have done something else sooner. So if you're suffering with pain medication that's not helping you, epidurals, you've gone to a pain clinic, it doesn't seem to be helping you, you're told you may need surgery, you're contemplating surgery, at least come and talk with us first and get a second opinion before you blindly undergo these procedures, especially surgery. If you've already had a failed surgery, multiple failed surgeries, come and talk with us at least first before you undergo another surgery. We all know that each subsequent surgical procedure has an even lower success rate than the first or the subsequent procedure. If your symptoms are radiating into your hip, your buttocks, your groin, down your legs, numbness and tingling, weakness in your legs, foot drop, yes, we can help people with neurological deficit, foot drop, reflex loss. We've helped many, many people that were told that surgery was their only option. The surgeons sometimes try to scare you and say, oh, you have a foot drop, you have reflex loss, you have severe neurological deficit, you have a disc extrusion. We've helped many cases of disc extrusions, and we will tell you if we cannot help you. We will tell you, and of course we will not accept you as a patient if we don't think there's a very good chance we can help you. That's why our documented success rate is so high. Our success rate is over 92% because number one, we're one of the most experienced facilities in the country instituting this type of care. We've been doing it a long time. Our protocol is physician-directed. Our protocol engages other modalities as needed on a case-by-case basis. Of course, we have over 20-plus years experience treating patients, and we screen out and decline candidates whose medical records and evaluation indicate we are unlikely to help you. So if we can't help you, we will refer you out to the appropriate specialist. So as always, we are doctors dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. This treatment technology was developed by Dr. Alan Dyer, who is the former Deputy Minister of Health of Ontario, Canada. He was an MD, PhD. He pioneered the research on the heart defibrillator. We all know, very important invention. Research to develop the VaxD treatment was conducted over a period of 6 years with the combined efforts of physicians, engineers, and technicians at major hospitals. Many professional athletes in the NBA, NHL, NFL, you name it, Olympic athletes have used VaxD. Some of the names: Mary Lemieux, Greg Lloyd, locally, Tracy McGrady, some of the athletes from the Green Bay Packers. NHL, as we mentioned, hockey was a big one because this treatment was developed in Canada first, and now it's made down in Florida, in the USA. The technology is down in Florida, where they actually make the machines and manufacture them. So don't wait until your condition worsens. Call us today, toll-free. Our toll-free number is 1-888-222-8293. Again, 1-888-222-8293. Again, not 1-800, 1-888-222-8293 to schedule your free consultation. Also, 724-935-3300. Or if you'd like to fax over a report, and we encourage you to fax over X-ray, CT, MRI reports if you have those prior to coming in, or have it ready for when you come in for the consultation by faxing it over. We do have patients that come a great distance to come see us, many, many hours. In some cases, we have people from out of state, Ohio, West Virginia, the state of New York, even further in some cases, because, again, they will travel for a treatment that works, and we're, again, very experienced in what we do, and we're the facility that has this type of care, so people will travel for it. And we do have a list of hotels on our website. Our web address is www.americanbackcenters.com. And again, our fax number to fax over reports is 724-935-3321, 724-935-3321 to fax over X-ray, CT, MRI reports. Make sure you put your name and phone number on the top if it's not on there so we know who to call back so we can discuss it with you. Again, our web address is www.americanbackcenters.com. If you have any questions for me, of course, we do have open phone lines, 412-825-6262. If you want to talk to me today on BackTalk, if you have any question whatsoever, of course, you can email me at Dr. Pedduzi at AmericanBackCenters.com. Also on our website, you can take a look and subscribe to our daily health update newsletter. Great health tips sent to your email free of charge daily. There's a quote for the day. I'll give you the quote for today. Wisdom comes from experience. Experience is often a result of lack of wisdom. Nice quote there. So every day you're going to get a nice quote very similar to that sent to your email with health tips. You also get signed up for a monthly In Good Hands newsletter. Some of the greatest minds we talked about, Dr. Oz and different people on Dr. Oz contribute to this monthly In Good Hands newsletter. So you get that free of charge when you sign up for our daily health update newsletter. All of it is sent to your email daily or once a month, free of charge as a free service at American Back Centers. Just go to www.americanbackcenters.com. And again, check out our webpage, our testimonials, a little bit more about how VaxD works, what we do here, all the different treatment options, which we're going to go over here in a few moments, that we offer here, and sign up for the newsletter, the daily and the monthly, both totally free of charge. You can also visit our blog. Our blog address is www.drpeterpedduziblog.com, and there's a direct link right on the website as well. In addition to the VaxD, the medical procedure that we offer here for the lower back and mid-back region, we also offer cervical disc treatment options. If you may have a disc problem in the neck region, degenerative disc, herniated disc, bulging disc, extruded disc in the neck region, cervical radiculopathy, symptoms down your arm, numbness, tingling in your hands, fingers, or even failed neck surgery. You're contemplating neck surgery. You want to get a second opinion first. We've helped so many people avoid neck surgery. People have already had a failed neck surgery. They're told that they need another one or they continue to have problems following the surgery. We've been able to help them get out of pain and disability as well. And the only way you're going to know is by coming in and at least talking with us. As you hear our advertisements, you have nothing to lose but the pain to come in and see us. It's a free consultation. We also offer therapy and rehab, state-of-the-art facilities for each body part, whether it's the neck, back, shoulder, knee. You're coming off a surgery of a replacement knee or hip. We do the therapy here at our office for that. Patients come in all the time with therapy scripts from their primary care specialists because they want to do the therapy here because we offer so much under one roof. In addition to the therapy, the standard physical therapy you would have at a physical therapist's office, we do the very similar therapy at our office. with the addition of chiropractic, if need be, the specialized treatments we offer here, nutrition, massage, all under one roof. Wrist, hand, finger, foot, ankle, and knee problems, examples including tendonitis, rotator cuff, and carpal tunnel, frozen shoulder, all those things are addressed right here. We have structured rehab programs for that. Again, we are not doing physical therapy. We're doing therapy. I can't use the term physical therapy because the physical therapist will get angry. We have to use the term therapy or rehab to discuss what we do, but basically it's the same thing, and we do much, much more, in my opinion, because of all the things we offer under one roof. And again, I'm not knocking PT in any way. They do great work, but they do get a little bit anxious sometimes if a chiropractor or another doctor does mention physical therapy because they have protection with that. So we are doing therapy and rehab at our office. We also have a great massage therapist instituting massage work, deep tissue massage, myofascial trigger point therapy, acupressure reflexology, looking at those muscle issues that are very important component of the problem, comprehensive nutritional consultations offered right here at the American Back Centers through standard process. If you'd like a copy of the symptom survey, again, addressing symptoms that you may be experiencing, give us a call. We can send it to you. You can send it back to us, and we can score it for you and tell you exactly what nutritional issues you may have. In fact, I'm starting a course, just started it last night, for a certification in functional medicine. So I'm going to be able to help even more patients here soon once I go through the functional medicine program. If you know anything about functional medicine, it really looks at the true root cause of the problem. And I'll be getting into that more in future shows as I go through the course and get my certification, an eventual diplomat as well, credentials. But I'm very excited that I've started that functional medicine program just last night. So we do a lot of nutrition here at our office. I'm very into nutrition. That's why I'm doing the functional medicine course as well. And a lot of good things to come in the future, additional services here at the American Back Centers. Custom-made orthotics, computerized digital scanning, assessing for foot dysfunction. So we have a truly custom-made orthotics that we offer here at the American Back Centers. We have a 3D digital scanning system that you stand on, and it scans your foot and gives you a truly accurate interpretation of any problems you may have. Patients may have bunions, heel spurs, plantar fasciitis, problems in their feet with their arches that may be causing issues in the hip, the back, the knee, even up into the neck. And sometimes it's the final 10%, 5%, even 1% of their problem that just won't go away, and then we look at the feet, and that solves that final 5% of the problem. Acupressure treatment, great success, especially now with sinus issues. A lot of people having allergies and sinus issues, helping promote drainage with our acupressure treatment. In-house X-ray, nerve conduction, ultrasound testing done right here at the American Back Centers. And we have a convenient MRI CT facility right across the street. North Pittsburgh Imaging, if you need an MRI CT, we can write your prescription. You literally go right across the street and get it done. So very, very convenient. I'm also a certified personal trainer. I can help you get back in the gym and do things correctly so you're not ending up back at our office in pain. A lot of people have good intentions, as I always say, going into the gym, and they end up hurting themselves. Whether they're trying to compete with the guy next to them to lift more, or they just don't know what they're doing. So we can definitely help you with that. I'm a certified personal trainer as well. So finally, with the VAXD, of course, VAXD, when we talk about, is not considered traction. The FDA does not consider or approve traction for herniated disc. Again, this treatment decompresses the disc with the potential for correction of herniated disc material or bulge extrusion, thereby improving, restoring the patient's functional capacity. So truly addressing the actual cause of the problem, not just putting a Band-Aid on the problem. And it's truly opening up that disc space, allowing fluid and nutrients and oxygen to come back in. Also, creating that negative pressure, creating that reduction in discal pressure. That's what makes VAXD different or better than spinal traction, or these so-called disc therapies, decompression therapies you hear out there advertised, spinal decompression. Traction and inversion tables and these decompression devices You hear a lot of different names, neutrodismosis, spinal decompression. A lot of fancy names can help but don't get to the root of the problem. Most back pain sufferers have a process that develops over time. Trauma to muscles, vertebrae, or discs occur either by small microtraumas or actual injuries, producing joint stiffness. This joint stiffness leads to disc dehydration, which is termed degenerative disc disease, causing the disc to crack, and then tears develop, producing bulges or herniations. VAC-C produces a vacuum effect while drawing disc fluids back in the disc, rehydrating, and drawing any bulges or herniations back into place. The fluids drawn back into the disc contain oxygen and nutrients that create the healing environment that corrects the problem. Inversion tables or traction devices do not produce a vacuum effect because the muscle that surrounds the joint are very very strong, and when an attempt to stretch the joint is sensed, the muscles contract. Studies on traction show that the disc pressure actually goes up rather than down. The reason vaccines are so effective is that the pull curve is gradual and logarithmic that fools the muscles and allows separation to occur. A major consideration, of course, is the fact that vaccines have been proven and affects treatment in several separate and distinct clinical settings. It's important to note that clinical trials at teaching hospitals are largely earned out of patient populations who were referred to neurosurgical department because they had failed to respond to other non-interventional treatments. No other non-interventional means of treating low back pain, mechanical or otherwise, has a research backing to match the claims of VAX-D. So that's what makes it unique and effective. And that's why VAX-D's been around for 20 years and will be around for another 20 years. Many of these people, though, state that they're similar to VAX-D. It's like saying that a Formula One car can do 200 miles per hour, therefore all cars can do 200 miles per hour. They claim to achieve decompression of intervertebral discs. However, there's no published clinical studies using pressure monitors to support their claims. You will note that most of them quote VAX-D research in their promotional campaigns and websites. Many of these so-called clinical studies are not published in peer-reviewed medical journals. Unfortunately, linear traction has been shown to lower interdiscal pressure, has not been shown to lower interdiscal pressure, and has had a dismal track record with chronic low back pain, and is even contraindicated for patients with herniated discs. VAX-D is a patented technology producing consistent results in each of the 300-plus systems in the field. Some of the current traction tables make the claims that VAX-D is actually simply a programmed traction mode, intermittent traction mode. They claim that the same forces and cycling can be replicated by their traction tables by entering the appropriate ramping, static, rest, and hold cycles. These claims are simply not true. In fact, we saw even back in 2006, many doctors faced fines for advertising treatment with questionable, quote, spinal traction devices. Quote, FDA-approved medical technology, they were claiming, offered an 86% success rate for treating disabling back pain without surgery. You see them. I've seen even as high as 98% success rate. They make these claims for these disc treatments out there. They claimed an accidental NASA discovery. They ended up facing possible civil and criminal actions against the company that made this device, Axiom Worldwide. Now they're back under a different name, North American Medical. So you've got to be careful with this. And that's why a lot of these doctors, when you call their offices and you ask them, what treatment are you doing, they'll make up a name of a procedure. But if you ask them, what is the table, what is the name of the table, they will do everything they can to hide that. And that should put up a red flag to you. With VAX-D, you always know it's VAX-D. VAX-D, you can do the research on it. VAX-D has been around. It has the research. And will be around for another 20 years because it works, and it's backed by real science. If a doctor is trying to hide what they're actually doing by putting made-up names in front of what they're doing and not actually telling you the name of the actual procedure, then you have to have a lot of red flags and questions. And you see that, and you have to be very, very skeptical because you may get hurt. You may be spending thousands of dollars. I've seen some of these treatment programs, thousands of dollars, upwards of $10,000 for these procedures, and patients are getting no better than using an inversion table or a traction device. With VAX-D, again, we see the only FDA-approved, safe, clinically proven medical disc treatment out there that actually is backed by real science. So if you'd like to schedule a free consultation at no cost or obligation, please call us again, toll-free 1-888-222-8293. Again, 1-888-222-8293. 8293 to schedule your free consultation at no cost or obligation. We sit down and answer all your questions you may have, doing a detailed neurological, physical exam, detailed history, determine if you're a candidate for any of the therapies, including BackD, that we offer here, all under one roof right here at the American Back Centers. We do offer that free DVD. This is when Channel 11 did a medical breakthroughs report on our office. They brought the TV cameras out and interviewed Dr. Miskovich. You can get this on a free DVD. We also have the 24-page Keller booklet describing the BackD in and out. Of course, you can visit our website, learn more about what we do, www.americanbackcenters.com. We also have the research papers we send out. The first paper was published in the Canadian Journal of Clinical Medicine. This research was done right here at the American Back Centers. Knife in the Back article showing the failures of back surgery, specifically fusion surgery, and why surgery is not the best approach for chronic back pain. We also have the blue workers' comp and the yellow auto accident booklets helping you as an injured workers' comp person, if you're injured at work, helping so you're not taken advantage of. So you know your legal rights, you're not taken advantage of by the insurance company and or your employer, which we see too common in today's society. So if you know someone that's been hurt at work, get the blue workers' comp booklet. It's a free booklet. Or the yellow auto accident and personal injury booklet describing your rights when you're involved in an auto accident personal injury case. They're both totally free of charge. Finally, we're going to talk about a couple more things before we move on. We talk about some of the latest research. We even have independent studies done by Independence Blue Cross Blue Shield showing BackD to be even higher than what BackD itself claims to be. Success rate over 88.8% success. Nationwide, BackD centers claim upwards of 75% success rate. Some of the most experienced facilities, like ourselves, are upwards of the 90 percentile because we have more experience. We've been doing it a long time, and we've perfected our protocols. But even independent studies are showing extremely high success rates, even from insurance companies. Also, we're going to give you a couple quick testimonials. This is from a patient who received BackD at our office here at the American Back Centers. He goes on, I wish to convey my thanks for the BackD treatments I received at your back center. Prior to these treatments, I had been going through different levels of back pain and discomfort for a period of about 20 years. He had back pain. And approximately in the month of April, I was doing normal yard work, such as raking and generally cleaning my yard. When the pain became so intense, I could only work for limited hours and could barely walk, stand, or bend over without discomfort. 3 trips to my chiropractor gave me temporary relief, but for no more than a day. I then consulted a neurosurgeon who gave me a series of exercises to do for a period of 6 weeks. When this brought no results, he had an MRI performed to check the condition of my back. The results showed one disc to be herniated, another to be collapsed, while a third was compressed. When I asked what could be done, he asked if I was still able to go to work and perform my work functions. My answer was yes, but at times with severe discomfort. His answer was as long as I was able to work, the risks of back surgery were not a good alternative. This is coming from a neurosurgeon. Faced with the situation of not being able to do some of the tasks I enjoy at home, as well as recreational likes, I decided to look into the BackD treatment, which I had only heard a little bit about. After only 5 treatments, the results were apparent in the reduction in pain levels, and I found I was able to sleep with a much longer period on my back. After about 10 sessions, I was faced with something I had not experienced in quite some time. I would actually have to set an alarm on the weekends to prevent me from sleeping in too late. Prior to this, I would be awakened by my back pain and simply could no longer stay in bed. After 25 sessions, I felt as good as I had been before my back problem commenced. I'm very aware of how easy it is to bring on a relapse and do things differently than I used to. Hindsight is 20/20, but I would say that the alternative of surgery, which would have treated only one condition, is now not an option. I would also add that this treatment, BackD, addresses all 3 problems I had, not just one. Again, I would like to thank you and your courteous staff for a new lease on life. Again, this is from a patient that received BackD at our office. You can see more testimonials on our website, www.americanbackcenters.com. BackTalk.com. So as always, the real question should be, why would you even think about surgery with all its complications and lack of success, not including the normal risks, including infection, bleeding, or blood clots that can occur with any surgical procedure, scar tissue, and then just the lack of success that we're seeing with these spinal surgeries when VAX-D is an option. VAX-D is a non-invasive treatment with a very safe, with a much, much higher success rate than surgery, pain injections, epidurals, or even physical therapy. Many patients go this route and eventually end up at our office wishing they would have come to us much sooner, or actually first. Remember, VAX-D addresses the structural cause, the issues, not just the symptoms. Truly decompressing the disc, restoring the fluid and oxygen content to that compressed, degenerative, desiccated, starved disc, taking the compression off the spine of the disc, relieving your pain associated with low back pain, disc problems, sciatica, stenosis, numbness and tingling, foot drop, weakness, and even failed back surgery cases. As always, as I talked about this many, many times on the show, the overuse of surgery has been perhaps the single most damaging medical intervention for back pain sufferers. This is from a Dr. Bigos and Battle research paper reported, quote, surgery seems helpful for at most 2% of the patients with back problems. Its inappropriate use can have a great impact on increasing the chance of chronic back pain disability. Very, very, very important to note. All right, so before we get into the nutritional segments today, I did touch a little bit on, we were touching on the CBD, the hemp oil, earlier on this show, talking about the only thing that helped one of my patients with severe pain. Even though his Percocet, his prescription pain meds weren't even touching the pain from his knee infection, the CBD, the highest level now, this level 5, with 200 milligrams of CBD, they do go up substantially. The level 1 only has 25 milligrams. Level 4 has 100. Level 5 actually has double the amount of level 4, and it does make a huge difference. And this was the only thing that actually took the pain away, and he actually went out in the yard and worked that day with a knee infection because he felt so good. And this is the level 5 hemp oil, topical hemp oil, that we offer here at the American Back Centers with a extremely high level of CBD. And their motto, I know this is kind of corny, it says, doesn't get you high, just better. And you're not going to get high just because you're taking a hemp oil. The CBD doesn't get you high, it just gets you better, it takes the pain away. And sometimes even more powerful than prescription pain meds and without side effects because it's completely safe. And it's important to note that. So we have for that here cannabis-infused ointments and creams. Level 5 is the highest level with 200 milligrams of CBD. Legal in all 50 states, FDA-approved active ingredients right here at the American Back Centers. Also, as always, when we talk about the best liquid multivitamin on the market, the Intramax and IntraKid for the kids, lots of great research supporting the effectiveness of this product. They have patented intracell technology proving that the product is going into the body and being absorbed, also finding toxins within the cells and attaching and binding to them to get your toxins out of the body. That actually detoxifies the body as well. A great liquid, carbon-bound, organic, 100% organic liquid multivitamin. So you're getting nothing unnatural, no allergens, no artificial ingredients in this product. 415 different ingredients all in 1 ounce of Intramax. So if you're looking for a starting point, the best multivitamin on the market, you're not taking a pill. You don't have to worry about it dissolving and not getting what you're paying for. Intramax is the great starting point. We offer a discount or free shipping for trying your first bottle of Intramax or IntraKid for the kids under the age of 18. Call us today and try the best multivitamin on the market. In my opinion, I take it myself. We also have another great product as an alternative to hyaluronic acid, glucosamine. We do have a great liquid glucosamine product with hyaluronic acid, glucosamine, chondroitin, collagen, and MSM all together. So it's probably one of the best products on the market for joint repair. But if for some reason glucosamine and hyaluronic acid is not working for you, there is an alternative. Esterified fatty acid complex, both in a topical cream and capsules. There's some great research showing compared to glucosamine, people that do not do well with glucosamine, There's usually about a 40 to 50% success rate with glucosamine, hyaluronic acid, and the like. Esterified fatty acids may be what works for you. So if you're suffering from joint loss in the hips, the knees, cartilage loss, and you still have some space left, and you want to avoid getting a knee replacement or hip replacement, try this, the esterified fatty acid cream or capsules. We offer it right here at the American Back Center, so we can send it to you. You can pick it up right here at our office. Also, we have an exciting new product for carpal tunnel. It's the vitamin B6 in the appropriate active form, as well as thiamine B1 and zinc. A lot of research showing those key ingredients together. Again, the appropriate form of B6, the active form of B6, with B1 and zinc, seeing dramatic effectiveness for carpal tunnel patients. If you'd like to try the B6, B1 plus zinc, you can pick it up, or we can send it to your home. Also, we have a great product for yeast infections, Coprolix, and a lot of patients are suffering from yeast-related issues. We do have a yeast-controlled diet information we can give to you to help with that as well, but there's a nice nutritional product called Coprolix that you can try as well. Very effective for yeast infections. So just a couple of things I want to highlight from time to time on our nutrition segment today, as well as our CPT ointments, the level 5, superior results to even prescription pain medication. Into the nutritional segment today, falling is taking a toll on the elderly brains. It goes on to state, falls are a leading cause of injury among Americans aged 65 and older, with 1 in 5 leading to a serious injury such as a broken bone or head injury. More than 1 in 4 older Americans fall every year, and such falls are the most common cause of traumatic brain injuries among this population. In March of 2017, the Centers for Disease Control, CDC, released a report with some startling figures regarding TBIs in older Americans, including those related to falls. Among those 75 and older, 1 in 45 suffered from a brain injury that led to emergency room visit, hospitalization, or death in 2013, a 76% increase from 2007, with the primary cause being falls. When brain injuries due to motor vehicle accidents decreased during the study period, and considerable attention has been given to concussions in the youth as a result of sports, far less attention has been given to the risk of brain injury in older Americans due to simple falls. The next paragraph, urgent need for fall prevention efforts. The CDC cited an urgent need to increase fall prevention efforts in older adults, given the concerning increase in fall-related brain injuries. Adding to the risk, once a person has fallen, their likelihood of falling again doubles. Risk factors that increase a person's risk of falling include lower body weakness, difficulties with balance and walking, vitamin D deficiency, there it is, vitamin D again, use of certain medications, such as sedatives or antidepressants, vision problems, which we're going to address here soon in this article, foot pain or poor footwear, hazards in your home such as clutter, throw rugs, or uneven steps, health conditions such as Parkinson's, Alzheimer's, and arthritis, as well as recent surgery such as a hip replacement. Next paragraph, lack of physical activity increases fall risk. One of the main reasons why exercise is so important in the older population is that doing it so can significantly lower your risk of falls and all your health risks that go along with them. Not only that, but if you do fall and you're a regular exerciser, you're less likely to get hurt. Older adults who took part in an exercise program were 37% less likely to be injured during a fall compared to non-exercisers, according to the research published in the British Medical Journal. This included a 61% lower risk of having a fall-induced broken bone and a 43% lower risk of sustaining a fall-related injury serious enough to require admission to a hospital. The exercises included an emphasis on balance training, along with strength and functional training, even Tai Chi. We talked about the whole body vibration therapy. Of course, that's a good one. Just simple balance training for strength, functional training, and even Tai Chi. As you get older, your muscle and bone mass decreases, and your senses that guide your balance, vision, touch, and proprioception may all start to deteriorate. This can make you unsteady on your feet. However, 8 weeks of balance training reduce slips and improve your likelihood of recovery from slips among the older population. Balance training has also been found to be effective in improving functional and static balance, mobility, and falling frequency in older women with osteoporosis. Since exercise strengthens both your body and your mind, it's likely that regular exercisers are not only physically more able to prevent falls, but may also be quicker mentally, perhaps allowing them to reach out and grab a railing for support before succumbing to a fall. So some easy strength training exercise to reduce your fall is on his website with his article. Strength training is also important for the older adults as it helps to maintain healthy bone mass, prevent age-related muscle loss, and strengthens your connective tissues, tendons, and ligaments, which helps hold your body in the upright posture. Strength training also helps with functional movements, the ones you do every day, which will make activities like climbing stairs and getting out of your chair easier. This, in turn, will lower your risk of falls. The first exercise he goes over is a simple knee extension. Knee extension exercises can help strengthen your knees, which help to improve your balance and reduce your risk of falling. You simply just sit in a chair with your back straight and knees bent, slowly extend your right leg or left leg out in front of you, and hold for a few seconds before lowering it back to the starting position. Repeat with your other leg. Do 10 reps of each leg. Simple. For more advanced versions, strap an ankle weight around each ankle. Aim for a weight that is heavy enough where you can do no more than 15 reps per leg. As you get stronger, add more weight to keep it more challenging. Next exercise is a partial squat. Squatting exercises helps to increase hip flexibility and strengthening your hip flexors and quads. They will also improve both your walking ability and your ability to stand from a seated position. They can also improve your overall balance and stability, reducing your risk of falling. For the beginner version, stand up using a chair for support and perform a standing partial squat. Remember to push your buttocks out as you bend to maintain a straight back posture. Do not bend your knees past your toes. Next paragraph, taking care of your vision health. Vision is very important. Being able to see clearly is important to avoid tripping hazards and avoid dizziness. Your diet is key to protecting your vision. So eat plenty of vitamin C-rich foods, which may lower your risk of cataracts. Bioflavonoids, which may also have a great effect for consuming with vitamin C, are also important. Excellent dietary sources of bioflavonoids include dark green or dark-colored berries, dark leafy greens, garlic, and onions. Other notable nutrients for vision health include astaxanthin, animal-based omega-3. A good example is Alaskan salmon, blueberries, bilberries, black currant seeds, vitamin D, lutein, bioflavonoids found in tea, cherries, and citrus fruits. And you can get the lutein and astaxanthin found in green leafy vegetables and pasteurized egg yolks. Besides eating plenty of the nutrients above, carotenoid-rich vegetables, organic pasteurized egg yolks, omega-3, and astaxanthin-rich wild-caught salmon are beneficial for vision health. Another important dietary aspect is to normalize your blood sugar, as excess sugar in your blood can pull fluid from the lens of your eyes, affecting your ability to focus. It can also damage your blood vessels in your retina, thereby obstructing blood flow. Also, finally, blocking blue light to protect your vision, especially at night. Many people are unaware of the importance of avoiding exposure to blue light after sundown, including the light-emitting diode, LED, lighting, and electronics. Near-infrared light is important as it primes the cells in your retina for repair and regeneration, which explains why LEDs, which are devout of infrared, are so harmful for your eyes. There are cells in your retina that are responsible for producing melatonin in order to regenerate your retina during the night. If you use LED lights after sunset, however, you reduce the regenerative and restoration capabilities of your eyes. With less regeneration, you end up with degeneration later on in life. So you can end up with age-related macular degeneration, which is a primary cause of blindness among the elderly, and also contributes to falls, of course, as well. Also, he recommends using blue-blocking glasses after sundown and swapping out your LEDs for clear bulb incandescence or even candle light. For your computer, reduce the correlated color temperature down to 2700 K, even during the day, not just at night, because many use this. You can use a software, Iris, for this purpose. So down to a color temperature of 2700 K. How to make your home safer to avoid falls, finally. Home hazards can make a significant contributor to falls, as it's estimated that one-third of falls in the elderly population may be due to environmental hazards that could easily be addressed. So number one, install safety bars and grab bars when necessary, such as in the shower, bath, or near toilets. Stairwells should be well lit, with sturdy railings which extend beyond the first and last steps. Remove loose throw rugs and tack down all carpeting and rugs. Put in anti-slip mats into the bottom of a bathtub, or consider a shower chair. Use a stool riser seat when using the toilet. Remove clutter from your home. Keep items used daily in easily accessible locations. Wear slippers or shoes with non-slip soles. Install adequate lighting in your home. Adjust electrical cords so they are not stretched across the floor so you're not tripping on them. And avoiding the use of chairs or stepladders to reach items. Use a grasping tool instead. In addition, fall mats, which are cushioned surfaces that help reduce injuries in the event of a fall, can be placed in frequent areas such as next to a bed, chair, or toilet. Some people may find added support from the use of a cane or walker, but be aware that some research has linked the use of walking aids to increased risk of falls as well. So it's important to understand that falls are not something that always happen and oftentimes are preventable. And by making sensible changes to your home, eating right, exercising, and taking care of your vision health, you can significantly lower your risk of suffering from a fall and related brain injury that can occur with that. So just a summary of what we talked about. Among the U.S. adults aged 75 and older, 1 in 45 suffered from a brain injury that led to an emergency room visit, hospitalization, or death in 2013. That is a 76% increase from 2007, with the primary cause being falls. So we talk about concussions, we talk about motor vehicle accidents, motorcycle people not wearing helmets. That's all important. But we need to look at the elderly population with brain injuries. From a simple fall, you can suffer a severe brain injury. So regular exercising, protecting your vision health, and removing home hazards can significantly reduce your risk of falls. So if you'd like a copy of the article, go to www.mercola.com or visit our Facebook page, American Back Centers Pittsburgh, on Facebook. Of course, if you have a second, like our Facebook page. You can send us a friend request and definitely download, print out any of the articles, including today's article. We have them all on there on the Facebook page if you'd like to read it or print it off right on the Facebook page, again, American Back Centers Pittsburgh. Also visit our webpage to sign up for our daily health update newsletter, as well as our monthly In Good Hands newsletter by going to www.American Back Centers Pittsburgh. Again, www.American Back Centers Pittsburgh. Also, you can visit our blog, www.drpeterpedduziblog.com. There's some great information updated on there all the time. Health information as well on our blog. If you don't know what a so basically an area that you have on the web that's totally devoted to health and health information. Many doctors have those, and you just continue to compile information on this blog. So there's a wealth of information. We've been doing it for years now on this blog. So, again, www.drpeterpedduziblog.com. And, of course, our webpage to learn more about our office and all the great things we do here, testimonials and treatments we offer here, www.American Back Centers Pittsburgh. I should say www.AmericanBackCenters.com. American Back Centers Pittsburgh is our Facebook page. Also visit that as well and take a look at that as well. So also we did highlight some of the key nutrients today, supplements we have here. We have so many different supplements to offer to patients. We do talk about getting it from your diet first, but in many cases you need extra. We talked about carpal tunnel, great supplement for carpal tunnel. We're seeing great success with it. the B1, B6 plus zinc in the appropriate active forms, significant relief with carpal tunnel, the Caprolix with yeast infections. If you're suffering from a yeast infection, you want to try something natural. We do have a yeast-controlled diet, which we give to our patients, as well as this supplement. There's a great product, too. I didn't know if we were going to have time to talk about it today, but I swear by it, and I have not gotten a cold, a cough, a sneeze, anything since I've been taking this product. It's called Garlic Plus, and it has a high dose of garlic as well as vitamin C in this product, and it's a wonderful product for helping to fight viruses. And most of what's out there, we talked about last week some of the issues with pneumonia. A lot of it is viral-related, that's out there, and flu, whatever it may be, viruses. And the viruses are very effectively treated with a strong antiviral, and the Garlic Plus, with a combination of vitamin C and the other antivirals in this product, truly made an effect for myself as well as many of my patients in helping to prevent what's out there. And you see a lot of what's out there is viruses. And I swear by the product, and I think it's a great product, and I recommend it to you out there listening. It's called Garlic Plus, and if you'd like to try it, call our office, or you can pick it up right here at the American Back Center. All right, we are short on time, so we're going to give you some final closing thoughts. Again, remember, do your homework before pursuing any treatment option. Ask for the research. Go on the Internet. There's many scams out there, as we talked about. With Vaccine, you don't have to worry about that. We have a proven track record, time-tested treatment, very well-researched treatment, used worldwide at over 300 facilities. 3,000 patients a day are being treated with vaccine therapy. Accepted by all fields of healthcare, and most importantly, it's something that actually works. With Vaccine, the results speak for themselves. So we're going to be on next Wednesday, and I want to thank you for listening, number one. We'll be on next Wednesday and every Wednesday with another episode of BackTalk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to BackTalk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for BackTalk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.